And speaking of youth, there has been a decline in U.S. birth rates recently. According to the CDC, American families are having fewer children.
A couple of factors could play into this, from concerns about the future to people focusing on their careers. And of course, it can be costly to have a child. Our Washington, D.C. correspondent Rachel Knapp spoke with some lawmakers who have different ideas on how to help new parents. Good evening, Rachel.
Good evening, Mike and Eva. So it could be pretty overwhelming when you have a kid or have a kid on the way. You know, if you're a new parent, especially, you might not know the resources available to you, or even if you have been a parent for a while, you might not be aware of what's out there to help you, before the kid comes along and even afterwards. And then also, it can be very costly. Those hospital bills can be costly for American families. So I spoke with a couple of senators about their different proposals on how to help families and babies. According to a Lending Tree study, families spend almost a fifth of their annual income on child-related expenses. The cost of childcare, extracurricular activities, and basic food and care costs have continued to rise.
The thing I heard over and over again is it's harder and harder to afford kids.
Pennsylvania Senator Dave McCormick is co-sponsoring the so-called Moms Act. The legislation would create a website of resources, pregnancy.gov, for expecting and postpartum moms. It aims to give women increased access to adoption agencies, pregnancy resource centers, health and well-being services, including financial, nutritional, and child care assistance.
The Moms Act is meant to help women, in particular moms, have the kind of support pre-birth, postpartum, to be able to early childhood education, counseling, the kind of support they need to be able to make it through some of those difficult periods. And we need to support moms, we need to support families.
The United States is one of the most expensive countries in the world to have a baby. In New York, a traditional birth can cost upwards of $8,000. When you're having a baby, the last thing you should be worried about is how to pay your hospital bills.
New York Senator Kirsten Gillibrand is sponsoring legislation that would make childbirth free for families with private insurance.
It would do so by categorizing all expenses associated with prenatal, childbirth, and postpartum services as essential health benefits, and requiring insurance companies to fully cover those costs so that families don't have to pay. This includes ultrasound, fetal monitoring, labor and delivery, and postpartum care, including physical and mental health support for a year after giving birth.
So far, these pieces of legislation have not made it far through the Senate. Reporting live for Erie News Now, I'm Rachel Knapp. Mike and Eva, back to you.